Hey everyone, welcome to the Front Row with Ed. So if I've ever seen you in the clinic, you know that we are a big basketball family. And a common injury that I get asked about a lot from different parents and other basketball players is, do I need to be worried about my jammed finger and what should I do about it? Okay, so most jammed fingers in basketball or volleyball or baseball aren't significantly serious. You just take some time off. We'll talk about what you need to do for it. But there's also a couple conditions when just buddy taping isn't going to do it, okay? And so we'll talk first about a typical jammed finger that my 11-year-old daughter just had at a tournament a couple weeks ago and kind of what it looks like. And then we'll also talk about a couple other conditions that will require possibly some splinting and some longer time away from the court to prevent any further type of injury to the fingers in the future, okay? So let's get going.
So first we have a typical jammed finger, and the first thing you look for is to make sure there's no obvious deformity, which there is not. There's some swelling and some discoloration, which is pretty normal. So treatment for this can be slight distraction, actually pulling just a little bit on the finger, try to get some range of motion, and then you want to try to get some ice on it, buddy tape it to the next finger for 2 to 3 days, and then slowly regain your lost motion. So now we get into the mallet finger, which is a little bit more serious because you do have an obvious deformity. As you can see in the picture, you cannot straighten out the tip of your finger. And this is a result of a tear of the extensor tendon off of the bone. Okay, so probably not surgical if you can jump on the treatment right away. And the treatment is wearing a brace full time, 24 hours a day, for about 2 months, 6 to 8 weeks. You cannot let that tip bend, okay? Now, after it's been 8 weeks, you can pull it off and start to see if you can get some range of motion and see if that extensor tendon has repaired itself. If not, see a surgeon, as you may need surgery. Next, we have a Boutonniere Deformity, which is French for buttonhole, usually a result also of blunt trauma to the end of your finger. This involves a tearing of the extensor tendon at the middle part of the joint. So now what happens is you're unable to completely straighten out your finger because the extensor tendon is torn. Conservative treatment, once again, is wearing a brace, 6 weeks continually. Do not take it off. Allow that extensor tendon to heal, and you may not need surgery. After the splint comes off, regain motion in that knuckle. This last one is a bit gruesome, but this is my thumb, also from playing basketball. Just reached out to deflect a pass and felt a little burning sensation in my thumb and looked down and not so good. Okay, so I do not recommend just buddy taping this and calling it a day. This is what we call an open fracture with dislocation. So it requires immediate medical attention for fear of infection and everything else. So luckily, I did not need surgery, but I was in a cast for 6 weeks. And I have regained full range of motion function, but it did take approximately 4 to 5 months for it to completely come back. Okay guys, let's summarize. Okay, so luckily most jammed fingers are pretty easy to care for. A couple things we want to look for, we already talked about, is any obvious deformities and the ability to move the finger at each joint, okay? Assuming that you can, then you're just going to be icing it, you're going to rest it, and then buddy tape it, and then slowly regain any lost motion, okay? If you have any questions, let me know, and hopefully this helped. Thank you.